So what is the pelvic floor? It is first and foremost a powerful, supportive net that is also flexible and responsive to your needs. So the pelvic floor is a group of muscles, ligaments, and connective tissue, as you see here on this graph, that support, first of all, your clitoris, your vagina, your bladder, your uterus. It also supports your anus, your rectum. It is involved with urinary function, with fertility, reproductive health, and with GI health as well. And it really is this supportive net that can also impact, by the way, core strength, posture. And it's an important part of your body that I want you to become. All of our body is beautiful and sacred, and I teach my kids that their pelvis is beautiful and sacred too. So we can go through all of these different muscles, but we don't need to today. The point is that it's a supportive net. It's there to help you throughout life, and I want us to be conscious of it and really embrace its strength and what it does for us every day. So what are specific pelvic floor challenges that impact the fertility journey? You see them listed here. Really, our pelvic floor impacts us through so much of our life, not just in our reproductive years as young women and women that are in their 30s and 40s, but also postmenopausally. So throughout our life, we're impacted by our pelvic floor. And intentionally nurturing its health is so important. So one of the main ways I see issues with pelvic floor or challenges with pelvic floor become apparent is that women have vulvodynia. So vulvodynia means that with touch of the vulva, which again is the outside structure of female reproductive anatomy, the labia, also the opening to the vagina, that with touch, that is really painful. So if later on in the slide I have listed on the third one is dyspareunia. Dyspareunia is pain with intercourse. But when women come to me saying that they have pain with intercourse, it's important to figure out, is that pain with insertion, which would make me think more about vulvodynia, pain of the outside, versus is that pain with deeper penetration, and that makes me think of other things that we'll go through here. Next on the list is vaginismus. So vaginismus is when our pelvic floor muscles are very tight. And any sort of penetration, whether it's with, there's varying degrees of this, but I see it quite severe, where even, a digit, a finger is incredibly painful for women with vaginismus because their pelvic floor is so tight. This makes speculum exams painful. It makes intercourse painful. We are at risk of both vulvodynia and vaginismus and dyspareunia and pelvic pain when we have history of trauma, when we have different conditions that I'll go through. But I think it's so important, and I'll talk about this more, that we become aware of this, that we become aware that it doesn't have to be this way, that we can work through this, and finding a provider who makes you feel safe. And then working with a team like Alyssa with physical therapy to help you heal. So when a woman comes with pelvic pain, and specifically pain with intercourse, I'm thinking more about endometriosis, which is an inflammatory condition when the lining of our uterus implants outside of our uterus in our pelvis and causes essentially bleeding in our pelvis when we have our periods. And that local inflammation and scar tissue that develops can cause both pelvic pain and infertility. So I'm always thinking of that. Ovarian cysts can cause pelvic pain, and also fibroids can cause a mass effect because fibroids are benign overgrowth of the muscle layer of our uterus. As they grow bigger, they can be causing pelvic pain, pain with intercourse, so we're thinking of that too. The pelvic floor is so important. I think your relationship to your pelvic floor, when it comes to your delivery experience, all of fertility is such a vulnerable journey, trying to get pregnant, the hopes and fears during pregnancy, being so vulnerable during either a vaginal delivery or a C-section. And having a good connection to your pelvic floor is so important to feel empowered in that experience, no matter what happens. After delivery, with how we heal, our postpartum healing. So we can have vaginal laceration tears of part of our pelvic floor, which we call our perineum, which is the area, the tissue in your vagina and your anus. And pelvic floor health really impacts how well you heal there. Prolapse happens, we're more at risk of that the older we get. So after vaginal deliveries, pregnancies, in our postmenopausal years. And prolapse is when our pelvic floor muscles may be weak. And so the cervix or the uterus can actually kind of prolapse downward and even protrude past the vulva. And so that is associated with incontinence and discomfort and feelings of shame. And so all of these things can be helped and mitigated by strengthening